I think prioritizing self-care skills. So you'll remember at the beginning I talked about the ways that I see this like intersections of disability or autism and sexuality, and that people tend to focus solely on self-care skills. That's not to say that they shouldn't be focused on. So I do think that it is important to prioritize intimate self-care skills, right? So like toilet training, doing that as early as possible, or if not, sort of like making efforts towards getting some support with helping to toilet train somebody. That's toileting and bathing are two routines where people can be especially vulnerable from caregivers or people that are professional helpers if they're having to do those self-care skills. And it sends the message that like it's okay for somebody else to touch my body in these ways. And how can we embed consent into those when we are teaching them? So things like showering, bathing, and menstrual care is definitely one that comes up for sure. And so I have another quick activity example. And again, this was basically learned because I messed up at teaching menstrual care to somebody and like when they should change or not change a pad. Here's an example of a short activity that I will sometimes do with students that I'm helping to teach menstrual care routines to, if that's something that you might need to do. One thing that I find is that sometimes some broad instructions will be given to a student in terms of like, oh, if you see blood on the pad, then that means it's time to change it. But often that's actually not the case. There's sort of different amounts of blood that might mean that the pad needs to be changed or not changed. And so I just have like 3 separate pictures. We can certainly have a bunch of different variations of this, if especially if a student is finding that they have to they're thinking that they need to change their pad with like a super high frequency, if they're even seeing like a little bit of blood. So I'll basically, again, do like a sorting activity. So this is helpful for students that might not have the language. And so change and don't change piles. And so change might have like, you might have to support that with like another little picture of what that looks like, or like a visual of like going into the bathroom. But you can just put change and don't change. And so showing different pictures of the pads and saying like, okay, like if your pad looks like this, do you have to change it or not change it? Another thing for this activity is that I try just as a point of professional perspective, I try to avoid the words like dirty or clean, just because we don't want to send the message that menstrual blood is dirty or unsanitary in some way, because it's just completely normal bodily discharge. And so I will usually try to use the phrases like the pad needs to be changed, or the pad doesn't need to be changed, or the pad is used or not used, as opposed to clean and dirty. And so I would just show a picture to the student of like, okay, if your pad looks like this, do you need to change or you don't need to change? And then give the picture to the student and see if they can say that like, yep, that would mean that I don't need to change my pad. And then we have a picture of a pad that's got quite a lot of blood. And so this is something that probably would need to be changed to make sure that there isn't sort of like leaking and accidents. And so we would say like, okay, this pad, does it need to be changed or not changed? And then give it to the student and see if they can identify like, yes, it needs to be changed. But then again, like I said, there's a bunch of different grades in the middle where there might be like a little bit of blood and the student doesn't need to change the pad because they can still bleed onto it more, and then it will still absorb more blood. So this would be an example of like that it doesn't need to be changed. And you could have some with like just like a little bit of spots. These are just ones that I've created for this demonstration, because I do find that a lot of students will hear the message like, if there's blood on the pad, then change it. And they will change something like this that doesn't really need to be changed, and they're using pads at a pretty rapid rate. Also, some students will then have some sort of like fear of blood, so showing them pictures of this might help to sort of desensitize that like, this is how much blood you can see. It's okay, but it needs to be changed. This is how much blood you might see, and that's okay. It doesn't need to be changed. You can just pull up your pants and carry on with the day until the next time that you check.
see, who knew that you needed that much time to explain when you should and shouldn't change a menstrual pad? But there's a lot to think about, as I learned. So then there's other things like visual support, so task analysis with like, here's what changing a pad looks like. One other one that I also recognized that I needed to teach some people similar to the menstrual pad, because they were over wiping when they were after a bowel movement. So I made like a visual that was like, keep wiping if it looks like either of these, but you can stop wiping if it looks like either of the ones in the red. So like the far side has like a tiny bit of fecal matter still on it, but like you don't need to continue wiping. Because people were, a client was like, then their anus was itchy and they were scratching in public places, and then that was deemed inappropriate, but it was because they were over wiping when they were using the bathroom after a bowel movement. All right, and the last of the 5 is basically early bird gets the worm. I don't have to spend a lot of time on this because I've kind of talked about this a lot. Like, the best time to start is now, so don't feel overwhelmed if you're like, I haven't done any of this. Like, that's okay, you're here, that's first step. Think about something that you could start teaching now, or you could move towards teaching now. Teach it before you need it. So teach it here if you need it here, right? So we need to be thinking kind of along the lines, there's a behavior analyst, Peter Gerhardt, and he talks about the 5-year rule. I saw Peter at a meeting this weekend, and I told him I was going to give him a shout out, and that I talk about his 5-year rule quite a lot. So if you are going to need something in 5 years, start teaching it, 5 years beforehand, basically. These are just some like additional important topics that we don't have time to get into, but like what to do about crushes, what is safe, unsafe secret touch, what are some dating skills, what about a pleasurable solo sex life, what about relationships and what types of relationships people have. That's important too. I don't have time to describe all of these for you today, but these are all skills that like I have taught people and have broken down into some teachable steps for folks. One thing that I do often is sort of this like modified circles of relationships program in a variety of different ways. Again, it can be helpful to teach people like who goes where, and the self being in the middle and then branching out. So a little example of that is like, who are your friends? Getting somebody to name who their friends are. Oftentimes I will work with students who actually like can't name people in this circle. So then it's like, okay, we need to work on like friendship development or social development skills if that person indicates that that's something that they want. So say this person is named like Amy, Ethan, Sunil as their friends. And so I will kind of do like a sorting activity where I'll physically like put these out and say like, okay, what behaviors can you do with friends and what behaviors can you do with professional helpers? You can hug friends, you can give them their phone number, you can ask them about their date on the weekend. And professional helpers, what could you do? You don't hug them. You give your phone number to them if they need to get in touch with you. You don't ask professional helpers about your date. And then who do you kiss with an open mouth? And then we have that in the like neither of these pile at the bottom. So, and again, another like sorting activity that even folks that have difficulty communicating vocally, verbally can show what they know. And if needed, we can do these with pictures, right? So friends, you can hug, you can give phone numbers to, you can ask about their date. Professional helpers, you can do the exchanging phone numbers. And what about this picture here, kissing with the mouth? Who can you do that with in these 2 circles? Okay, neither. And so you put it in kind of like a bottom or like another pile off to the side.